Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Lymphogranuloma venereum, or LGV, is a sexually transmitted infection. It's caused by a specific type of bacteria called Chlamydia trachomatis. Now, LGV isn't as common as other STIs like chlamydia or gonorrhea. However, it's still important to be aware of this infection. LGV can cause serious health problems if left untreated. It's spread through sexual contact, which includes vaginal, anal, and oral sex. It can also be spread through contact with infected sores or fluids. Many people with LGV have no symptoms, meaning they can spread the infection without knowing it. Early diagnosis and treatment are crucial for LGV. If you are sexually active, talk to your doctor about STI testing. Knowing your status is the first step to protecting your health and the health of your partners. Lymphogranuloma venereum often has few or no symptoms. This makes it important to be aware of any changes in your genital area. Early symptoms of LGV can appear within a few days or weeks after infection. One of the first signs may be a small, painless sore or blister. This sore can appear on the genitals, rectum, or mouth. The sore often heals quickly, which can make people think they do not have an infection. However, LGV can still be present even if the sore is gone. Without treatment, LGV can progress to later stages. These later stages can have more serious symptoms. Swollen lymph nodes in the groin are common, and these swollen nodes can be painful. Other symptoms include pain in the genital area, discharge, and fever. If you experience any unusual symptoms, it's essential to see a healthcare professional. Early diagnosis and treatment are key to preventing long-term complications from LGV. Diagnosing lymphogranuloma venereum usually involves a combination of a physical exam and laboratory tests. A healthcare provider will ask about your sexual history and any symptoms you may be experiencing. The doctor will then examine any sores or lesions present. To confirm the diagnosis, a sample of fluid will be taken from the affected area. This could be a swab of the sore or a fluid sample from a swollen lymph node. This sample is then sent to a laboratory for testing. The most common test used to diagnose LGV is a nucleic acid amplification test, or NAAT. This test detects the genetic material of the Chlamydia trachomatis bacteria. NAATs are very accurate and can provide results within a few days. Early diagnosis is crucial for effective treatment and to prevent the spread of LGV. If you have any concerns or suspect you may have been exposed to LGV, don't hesitate to seek medical attention. Section 4. Treatment options and the importance of early intervention. The good news is that lymphogranuloma venereum, or LGV, is treatable with antibiotics. Early treatment is essential to prevent complications and long-term health problems. Doxycycline is the most commonly prescribed antibiotic for LGV. This medication is typically taken orally for about 3 weeks. It is crucial to complete the full course of antibiotics as prescribed by your doctor, even if your symptoms improve before finishing all the medication. This ensures the infection is completely cleared from your system. In some cases, other antibiotics like erythromycin or azithromycin may be used as alternative treatments. If the infection has progressed and caused complications, such as abscesses or fistulas, additional medical procedures may be necessary. These procedures might include draining the abscess or surgically repairing the fistula. Early treatment not only cures LGV, but also reduces the risk of transmitting the infection to others. If you are diagnosed with LGV, it's important to inform your sexual partners so they can also get tested and treated if necessary. Section 5. Preventing LGV, protecting yourself and others. Preventing lymphogranuloma venereum, or LGV, involves practicing safe sex and getting tested regularly for STIs. Using barrier methods like condoms during sexual activity can significantly reduce the risk of contracting LGV and other STIs. It's essential to use condoms consistently and correctly every time you engage in sexual activity. This means using a new condom for each act of intercourse and ensuring it is worn throughout the entire encounter. Regular STI testing is crucial, especially if you are sexually active with multiple partners or have a new partner. Talk to your healthcare provider about your sexual history and ask about appropriate STI testing for you. Knowing your status is key to preventing the spread of infections. Open communication with your partner or partners about sexual health and STI testing is also essential. Encourage each other to get tested and discuss ways to practice safer sex together. Remember, prevention is always better than cure when it comes to STIs.umcc, your ultimate medical consultant connector.